NovoPsych as a technology platform that makes it both possible and easy. So let's start with one client. This is where it gets really practical. This portion of the DASS-21 report of results, this is what is generated in NovoPsych, and this is one of the most widely used measures in mental health and also very widely used in NovoPsych. This is the same client, 2 administrations a couple months apart. I'm first just looking at the total distress score for now. So if you look at the percentiles, it's 98.7 at time 1, and then the 97th percentile at the second time point here on the right. So barely moved, and as the clinician, you'd be forgiven for thinking that maybe treatment is stalled or not working. But the graph on the right tells the real story. The client's raw score is actually dropped from the extremely severe range to the severe range. Now, that's genuine progress. Percentiles often just barely move at the severe end. And this is why NovoPsych reports give you multiple views of the same results, because what we know is that how information is presented changes what you can see in it. And behind every NovoPsych report is our great team of psychologists and psychometricians that are thinking really hard about exactly this. How do we display and interpret the results of each measure so that the clinical picture is as clear as it can be for you to act upon? And knowing whether change across time and treatment is happening is what really matters. So the next slide is one way that NovoPsych helps answer that for you. So this is the same client from the previous slide, and in addition to their total distress score dropping, their anxiety subscale score is also down 4 points. Now, is 4 points real improvement we are seeing, or is the client just having a good week? With NovoPsych, you don't have to guess. The report of results says it outright. So if you see the highlighted portion on the right side of the interpretation, it says anxiety has improved significantly, while the depression and stress subscales haven't. That's the reliable change index working behind the scenes. It means the shift is bigger than just measurement noise. So 2 reasons why this helps. With the client who says, I don't feel any different, you can show them in writing and visually where change is happening and where in time, and it reassures them that treatment's on track. So whenever we can, NovoPsych will tell you whether changes in scores are significant or meaningful. Now, one level up, and this I think touches on a lot of what Jason talked about, one level up from a single client is looking at your data across a whole caseload or even an organization. So in NovoPsych, that ability lives in a tab called Insights in your account if you have a NovoPsych Pro Plus or Platinum plan, or it's also an add-on to Practice Plan Psychometrics. And here's the headline, one number. In this example, 70.8% of this pretend clinician's clients improved significantly on the DASS-21 over time. Now, the key thing is the Insights tool requires nothing new from you. It reads the measures you're already administering, and for any client measured at least twice, it compares the first score to the most recent, and it does that across your whole caseload at once. So this gauge here that you see is literally answering, of all the clients I've measured more than once using a given measure, what proportion got better. Now, Insights is compatible with various broad outcome measures like the DASS-21, PHQ-9, GAD-7, PCL-5. We have a whole list I'll show you in a second, and that list keeps growing. We keep adding more. So if you're already administering measures in NovoPsych, check whether yours are on that list in Insights. You may have months of Insights data waiting. And if you're choosing where to start with measures or which measures to add to ones you're already using, consider picking one from the list in Insights so that every administration is really doing double duty for you. Let me actually show you very quickly where this lives live in NovoPsych. So this is our platform. It's a demo account. There's no real client data being shown. So Insight, the tab sits right at the top here. And on the left, I choose which measure I want to look at. So these are the measures that are compatible with this tool right now. So I have GAD-7 picked. And if you click on the summary data tab here at the top, there's the number live. So in this case, 50% of clients who come to you improve on their GAD-7 score over time. And if you want to click even a little deeper, you can select the Reliable Change tab on the caseload. What it will show you is the proportions in your caseload, which are significantly improved over time, showing little change or deteriorated. And so this red slice, the deteriorated, is who measurement-based care can especially help with, those clients getting worse. Although even the significantly improved can help you decide when someone is ready to move on from therapy to clear up your wait list. So if you've never opened Insights, there's your homework. Go find this number in Insights, and if you don't see this tab, it's a plan feature. Just email info@novopsych.com and the team will set you up if you are interested.